I think there's a prejudice on their side coming in. But you know, but the people who want us in that hospital aren't the doctors, they're the nursing staff. We have a whole component of what we do that is nurse education directed. A hospital ICU runs by nurses. The nurses run the show, they do the quality control, they're there at the bedside. So the group I'm most interested in Friend, Nebraska are not these two doctors. They're the head nurse and the nursing staff, because I can provide for them a nursing educator. Her name is Val Takis. She's getting a PhD at UCSF right now, and she is a critical care type of nurse, and she's run many ICUs. She'll give them policies and procedures they've never seen before. She'll go out there and educate their staff. She'll educate them by robot every day if they want. We can give you can use this thing as a teaching module. We'll consult on them anyway. If a nurse wants to consult, I'll do the nurse despite the doctors. If they want to consult, I'll do it. You know, I can do that. And I'm getting a Nebraska license, by the way. Because I can do a consult, and they call me, I just do a consult. I'm a doctor just like they are in Nebraska. I don't have to ask them to see their patients. But the nurse asks me, I can see the patients. So I see that the Trojan horse to get into Friend, Nebraska is the nursing staff. The doctors aren't interested at all, as far as I can see. So we're going to try that. So you can see that by strategizing with a service organization, the ATLA Health, and with a technology corporation, and I really respect this corporation. Now remember, Gary and I work all the time together. He gets no money from me, and I get no money from him. That's an honest relationship. We both want to give good care where we're going, and it benefits both of us. So, I mean, I'm not part of Eisenhower's military-industrial complex. Those of you here, some of you don't know those comments. So I'm not part of that.
Well, by practicing in another state, does it change your malpractice insurance?
Yeah, it varies. It does. For example, when I practice in Arizona, I'm covered by NorCal. When I practice in Texas, I have to get a whole new Texas-oriented malpractice. In doing robotic telemedicine, my critical care insurance rates do not go up. Because right now, the insurance industry views this as a way to cut down litigation. Because they're getting consultants going in where they never existed before. I know more than the doctor asking me to see the patient about what they're asking me to see. Therefore, I'm reducing the chances of litigation. Because mainly litigation goes because you didn't get a specialist to see the patient. Okay? So my rates aren't going up, but it's very tricky. Another thing, I've divided the United States into 17 regions. And right now, you can see Dr. Sax Miller. Sax Miller is the medical director for New York, New Jersey, and Florida. Is that a big area? It's like the Roman Empire until you got to go out and take care of Gaul. You know? Or how about North Africa? No, but Sax is, and each medical director has a kit of how to do this. And I've got two kits here. I got to give one to Nuck. Who's not calling you in the ICU today? I've got to give one to Nuckton and Newberry. Newberry is for a Utah, and a Nevada, Utah, and Nevada, Utah, and then Nuckton. Nuckton is
Maine.
Maine. Dave Hill, my guy who's back in colleague back east, and Nuckton is Arizona, Oklahoma, New Mexico, and Louisiana. It's fun. I've got all these medical directors, and these are doctors. They're critical care doctors who are really good. So I mean, the whole staff are dependable, good people. I don't have anybody there who is a suede shoe salesman. These are good doctors. And if this thing's going to go, I've got good people. And when somebody goes in a region, that's that doctor's responsibility to develop it. And any way you can. And we try to be innovative, too. We'll do whatever the staff wants us to. We'll use robots, we'll use carts, we'll use Skype. We use the old coffee cans with a cord. Have you ever used those?
Did it many times.
That's right. We'll do anything they want to do. That makes sense. But we're open to do things. Now listen, my last plea, my time's up, is, damn it, you residents, go to rural America. Don't spend all your time at a place that lacks imagination, has too much bureaucracy, and pays you too much like Kaiser. Thank you very much.